When people come in and they call them on the phone, do not ask them their date of birth first. So check this out, y'all. Okay, this is what happened to me yesterday. I had some blood work drawn yesterday. It was the craziest experience. And this is basically, I'm going to tell y'all what not to do before you ask their name. So I had, a physical a couple weeks ago, and then my primary care physician wanted me to get my blood work done, which is great because, I've been doing keto thing for a few months, and I want to see, what does it look like? What does that look like on that plan, and compare it to the last time I did it, which was like 4 or 5 years ago when I got some life insurance, and I was doing Whole30 at the time. So I go in and get my blood work, and I roll down to the basement to the phlebotomy lab, which is, I've been to this place a couple times. It happens to be in a building with my grandfather's name on it. It says the Sidney F. LeBauer Medical Building. And so if you guys don't know me, my name's Aaron LeBauer, and I own LeBauer Physical Therapy here. It's a 100% cash practice, and I help passionate physical therapists create successful businesses without needing to rely on insurance. And so I'm also, my father and uncles, my 2 uncles, and even actually my 3 uncles were all physicians. My grandfather's physician, and they started one of the largest multi-specialty practices here in Greensboro, which is now, for the last 20 years, been owned by the hospital system, but still uses our last name. And I've told y'all my story about marketing physicians, which ended in nothing, and even at this practice wanting me to come and buy lunch for 65 people. So I went there to go to the phlebotomy lab, and I roll in, and I open the door, and there's like 3 cubicle stalls with like privacy walls. There's privacy walls like way up high. Even me standing at 6'3", I couldn't see over them. And I see the woman sitting in number 1, and she looks at me, of course, no smile, of course. And then I hear a voice that says, "Come to cubicle number 2." And I'm like, is this God talking? It's like out of nowhere. It was like, "Come to cubicle number 2." I was like, huh? So I walk over there, and she looks at me, and she goes, "What's your date of birth?" I'm like, "Hi, my name's Aaron." She's like, "But I need your date of birth." Just like really matter of fact. And I'm just like, 12/1/73. And she's like, "What's your insurance?" I'm like, okay. I was like, Blue Cross. And she goes, she didn't say, "Hi, how are you?" Like, there were some seats there too. She didn't offer me to sit. Nothing. Like, she could offer me to sit, so I'm standing there, and she's like, she doesn't look at me, in the thing. She's like, which physician authorized this? And I'm like, Michael Rigby? And she's like, okay, come with me. And she's like, we walk back. She's like, sit here. Which arm do you prefer? And then I was like, oh my God, she's gonna like stick me really hard. But basically, here's the thing, is like, she could have smiled. She could have said, "Hi, my name's Betty, Amber, Joni, whatever. I'm going to be your phlebotomist today. Nice to see you. How are you doing? What's your name? What's your date of birth? What's your insurance? Okay, I just want to verify your physician." Like, there's absolutely no customer service going on, and it was just ridiculous. It was ridiculous. The other woman who was there didn't say anything to me either, and it doesn't take a lot of extra to be like, "Hi, how are you doing today?" "Hi, how are you doing today? I know you're probably pretty hungry because this is a fasting, blood levels, but, like nothing, no personality, nothing." But it's not the first time. So the main thing is the main way you can differentiate yourself from your patient's experience almost everywhere else, I guarantee you, is to be personable. Treat them like a real person. Ask their name. "Hi, what's your name? May I ask who's speaking?" Like, how hard is that? The other thing that kind of pisses me off a little bit is when I take my kids in to their appointments with pediatricians, and pediatricians always refer to me as Dad. or daddy. Like this happens at the dentist. This happens at the dentist, the pediatrician. And it's like, Dad, I mean, how about like look at the thing and call me Mr. LeBauer? You know, I'd be okay with that. And I'd really be okay with Mr. LeBauer. So, I guess that's the main thing. So I'm going to contrast that to this morning my wife took me to Orange Theory. And I've never been. Have you guys been to Orange Theory? Give me some thumbs up if you've been or know what I'm talking about. Orange Theory is like a chain of workouts, and everyone's wearing a heart rate, and you do like, I guess there's cardio, you know, there's treadmill, there's rowing machines, and then there's like a step with some weights and a TRX and that kind of stuff. It was actually pretty good. You know, I used to do a lot of heart rate stuff when I was racing bikes, and I'm like going, the only thing I'm thinking is like, why am I working so hard and my heart rate's not that high? Like my heart rate was fine, but it was my perceived, you know, so they put you in zones based on your percentage of max heart rate. And I just think they have my max heart rate at like 180, when my max heart rate when I was racing bikes 15 years ago, I couldn't ever get it to 190. You know, like it was like 184 might have been the highest I ever saw it 20 years ago when I was racing full time. So anyways, that's beside the point. What do? I come in a half hour early. There's someone to, you know, say hello. And as soon as I sign in, you know, she introduces me to the instructor. The instructor uses my first name multiple times. Even in the class, she's like, okay, guys, this is Aaron. He's new. He's going to be over here. Or spot number 2 for Aaron. Aaron's new. Hi, Aaron. Oh, Aaron, you're doing great. And it's like, she used my name like 5 or 6 times. I mean, and that's what makes people feel special. And I'm like, oh, man, I could go there again. You know, there's plenty of places I've been where no one's used my name. So if you can create an environment that's welcoming to people, that you use their first name, you ask their first name, you treat them like an individual, they're going to be so much more likely to do business with you.